Menopause. The word alone carries so much baggage. For many older adults, it's a phase whispered about, misunderstood, and often surrounded by myths. It marks the end of a woman's reproductive years, but it is so much more than that. It's a natural biological process that deserves better awareness and less stigma. Unfortunately, there's a lot of outdated or simply incorrect information floating around, and those myths can lead to confusion, fear, or missed opportunities to feel better. Let's clear the air. Today we're diving deep into some of the most common myths about menopause and replacing them with facts. If you're over 50, or even if you're still approaching that age, this is the kind of information that helps you make smarter health decisions and feel more in control of your body. First, let's talk about the biggest myth of them all. Menopause happens overnight. That's simply not true. Menopause is not a moment. It's a transition. It begins with a phase called perimenopause, which can start in your 40s or even late 30s. During this time, hormone levels fluctuate, periods become irregular, and symptoms start to show up. Menopause itself is officially diagnosed after 12 consecutive months without a menstrual period. And the symptoms? They often last for several years after that milestone. Here's another one. All women experience menopause the same way. Absolutely false. Every woman's body reacts differently. Some go through it with barely a hiccup. Others experience hot flashes, night sweats, mood swings, brain fog, and more. The range is wide and very personal. There is no universal menopause experience. If someone tries to tell you what's normal, take it with a grain of salt. What matters is how you feel and how you manage your symptoms. One of the most persistent myths is hot flashes are the only symptom of menopause. Hot flashes are the most talked about, but they're far from the only symptom. Menopause can bring fatigue, anxiety, irritability, memory problems, vaginal dryness, joint pain, changes in libido, and sleep disturbances. Some women even report heart palpitations or dizziness. If you're not sleeping well or feeling foggy, menopause could be part of the reason. Now, here's one that's especially harmful. Menopause means you're getting old and irrelevant. This myth is rooted in ageism and sexism. Menopause is a natural part of life, not a sign that you've lost your value. In fact, many women find a renewed sense of freedom and confidence once they are no longer dealing with monthly cycles or the possibility of pregnancy. Wisdom, life experience, and independence don't fade with age, they grow. Let's tackle another one. Menopause kills your sex life. This one gets repeated a lot, and it's only partly true. Yes, hormonal changes can affect libido, and vaginal dryness can make intercourse uncomfortable, but these symptoms can be managed. Lubricants, vaginal estrogen therapy, and open communication with your partner can help. Many women report that once they adjust to the changes, intimacy can actually improve. Less stress, more connection, and a better understanding of what they enjoy. Here's a dangerous one. You don't need to worry about birth control after 50. Wrong. While fertility declines sharply, pregnancy is still possible until menopause is complete. If you're still getting periods, even irregularly, you can still get pregnant. Birth control may still be necessary during perimenopause, and hormone-based options can also help with symptoms. Always check with a doctor before making changes. A frustrating myth. Hormone therapy is too risky to consider. Hormone replacement therapy, or HRT, used to be standard care for menopause symptoms. But a study published in the early 2000s raised alarms about increased risk of breast cancer and heart disease. What many people don't realize is that those findings have been reevaluated. For many healthy women under 60, starting HRT within 10 years of menopause can be safe and effective. It can relieve symptoms and help prevent bone loss, but it's not for everyone. Talk with your healthcare provider to decide what's right for you. Let's move to another common one. Weight gain during menopause is inevitable. It's not inevitable, but it is common. Hormonal shifts can affect metabolism, and many women lose muscle mass as they age. Combine that with a more sedentary lifestyle and emotional stress, and weight gain can sneak up. But it's not unstoppable. Strength training, healthy eating, staying active, and getting enough sleep can all help maintain a healthy weight. Another myth: menopause only affects women physically. Nope. The emotional and mental side effects are very real. Many women experience anxiety, mood swings, sadness, and a loss of identity. This isn't just psychological, it's chemical. Estrogen influences serotonin, the feel-good brain chemical. When estrogen dips, mood can take a hit. If you feel like you're not yourself, you're not imagining it, and you're not alone. A quiet myth that needs more attention is, you don't need to see your doctor once your periods stop. Wrong again. Regular checkups are even more important after menopause. Your risk of heart disease, osteoporosis, and certain cancers increases. Screening for bone density, cholesterol, and other age-related conditions should be part of your routine. Even if you feel fine, it's smart to keep those appointments. Some people believe natural remedies are always safer than medication. That's a dangerous assumption. While things like black cohosh, soy, or red clover are marketed as natural menopause relief, they can still have side effects or interact with other medications. Natural doesn't mean harmless. Talk to your doctor or a qualified health provider before trying supplements. Then there's the myth. Once menopause is over, everything goes back to normal. Not exactly. While some symptoms may improve, menopause marks a permanent shift in hormone levels. Bone density, skin elasticity, and cardiovascular health all change in the post-menopausal years. It's not about going back to the old normal. It's about adapting to a new stage of life with the tools and knowledge to thrive. And finally, one of the saddest myths: you just have to suffer through it. Absolutely not. No one should feel like they need to grit their teeth and wait it out. There are so many options now: medical, behavioral, nutritional, and therapeutic. You deserve to feel good in your body, no matter your age. Support is out there, and you don't need to do it alone. Menopause isn't something to be feared or ashamed of. It's not the end of youth, beauty, or relevance. It's a natural evolution. Like any transition, it can be bumpy, but it's also a time of possibility. More and more women are speaking out, sharing their stories, and demanding better care. And that's a good thing. So if you're going through it or it's already behind you, remember this: your experience is valid. Your body deserves respect. And the more we bust these myths wide open, the easier it becomes for everyone else too. Stay informed, stay curious, and never stop advocating for your well-being. You've earned it.